Brenda, are you on?
Yes, I'm here. I was on a provider call. They
Okay,
called.
that's fine. I just want to make sure you can hear me because I had a Teams meeting earlier and they couldn't hear me.
Everything is going crazy. I've been kicked off of Teams today. I've been kicked off of GoTo meeting today, and I've been kicked off of Zoom today. So I was really hoping that, so I've been on WebEx for a minute because I was afraid I was gonna have issues.
Okay. Well, and did we record last week?
It automatically records, so it should be in the downloading file.
Okay.
Yeah.
Well, I'm hoping that all goes well because we had internet issues last night, and this morning I had Brian reboot the system because we didn't have any internet. And then when I was on Teams and they could see me, but they couldn't hear me.
Yeah, I just checked and it's the recordings there.
Okay.
So, but yeah, because it starts recording as soon as I turn it on now. So
Oh, okay.
us talking is going to be on there. So we have to cut all that out.
Okay. But we have the ability to do that?
I hope so, because it automatically starts. And I'm afraid if I stop that recording, I won't be able to
Yeah,
restart
we did
it.
that one time and it didn't work right.
Right. So yeah,
Okay.
it's interesting. I've got a lot of upset people. So yeah.
Yeah. You and the
Yeah.
whole freaking
Yeah,
world.
and then they snuck it all in, and just like sneaking in the reporting requirements, they released that on Tuesday. And then the visitation from KDADS is they just sent out guidance where they can now have essential caregivers. They have to have policies in place for essential caregivers and run them through infection control training. And so now we're giving family the right to help assist with ADL cares. I don't know. I don't know.
And this is just to help with the
The
staffing
staffing
issues?
crisis, yeah. So KDAD's put out visitation guidance on Tuesday. Well, they published it on Tuesday and shipped it out, I think, Wednesday, and I reviewed it yesterday. But yeah, it's all about essential caregivers now, and which can be family members or loved ones, but they can only have one. And each home should have policies in place to make sure there's been training. I mean, it sounds good. It's just extra work for a leadership that's already extremely burdened. Now they've got 30 days to get policies and procedures in place to meet this new regulation that we don't know what the penalty is going to quite be yet.
Well, and the hospital that I just got off the call with, she said, are they really going to impose a $14,000 civil monetary penalty?
Is that what they said? Because if they
I
said that,
don't
I missed it.
know. I did, and I told her, I said, well, I listened to that thing yesterday and I may have not been listening as well when they talked about that, but I don't remember them saying any set amount. I said, but they are not afraid to impose civil monetary penalties because they've been doing that for long-term care for some time now.
Yeah, I had some homes get a little pushed off because in the overall document it talks about the implication of this for each home, and I'm wondering if that's where they pulled 14,000 out.
I don't know. This is the hospital saying it, so
Maybe the hospitals are different because no, they're not. They're not now.
You're all subject to it as well. So
Yeah, I know under from what I've heard from from my husband's business, that they can get fined per employee up to a certain amount. But the hospital would fall under the healthcare portion of that mandate and not the general public portion of that mandate. Yeah, I don't know. I don't know.
I don't know.
Yeah, it's definitely going to be interesting.
I don't know. It's all
Yep.
It's going to turn into a what show.
Uh-huh. And then from what I'm hearing, the state of Kansas wants to protest it
Yeah, Brian said governor, he asked me if I'd seen Governor Kelly's thing and he
Yeah.
said she's not for it. So
Right.
I
So
don't
what is
see
that?
what he was talking about, but
Yeah. Which again can help protect or change however you would protect if somebody
well,
else
and
is
like I
wearing
told him, she's sensitive to the rural environment. So in Kansas, so she knows what the implications are for the providers in the state of Kansas.
but that still doesn't change for our folks though, right? Because our folks take their federal dollars, right? So
Yeah, and the big like the conversation I had with the hospital was, is your Medicare Medicaid funding losing it worth it? And it's not going to be. So, well, I didn't mean to do that. Did that automatically share?
no,
Okay. Well, it wipes out my screen here, so I'm going to go ahead and share and then we'll see what kind of hoops I have to jump through today.
it is Friday and it's been interesting. So
Yeah.
had nothing but technological issues since 6:30, 7 o'clock this morning.
Yep. We'll see. You can see my slide, right?
Yes. Yep. And then bounce back to the video. Is that
Therein lies the problem. I have to stop sharing
and then go do it again?
and go to here and share. And you should see the video
Yep.
slide. Okay. Now, if I pull up the PowerPoint, can you see the PowerPoint now?
Yes.
So what I can't figure out is how to get back to that. There, maybe that'll solve my problem. I'm going to switch that back. Do you see the PowerPoint now?
Yes.
Okay. Okay, maybe I figured it out.
Good morning, everyone, and happy Friday. Welcome to our session 3 for Project Firstline. Today's topic is how respiratory droplets spread COVID-19. Again, we thank you for joining us today, and I will pass to Nadine.
Good morning, everyone. Fair warning, technology has not been my friend today, so hopefully we'll get through the next 30 minutes without any issues. So what we're going to talk about today is how respiratory droplets spread with COVID-19, and we'll have time to have some discussion and talk about where we go from here moving forward. Last time we talked, we Well, 2 times ago, we've talked about viruses and how to explain concepts of viruses to others. And today we're going to talk about something that has been a hot topic ever since COVID first emerged, respiratory droplets. What are they and how do they spread COVID-19? We know how important these questions are, and sometimes it's hard to explain these ideas to others. And when we talk about this was an issue from the very beginning, you remember? Masks required, masks not required, masks required, masks not required. Oh yeah, by the way, this is spread by respiratory droplets, so masks are required. So that was the conversation early on in the COVID outbreak. So we have been living the reality. One slide. So today we have 3 objectives. One is describe one characteristic of respiratory droplets, understand a way that SARS-CoV-2 moves between people, and explain why infection control actions focus on keeping respiratory droplets out of the air and away from other people. So we will play the video to get started here. And let me, before I click yes, I'm going to turn up my volume. And let me know if you don't hear it.
Hello, everyone. I'm Abby Carlson. I'm an infectious diseases physician and a doctor here at the Centers for Disease Control and Prevention in Atlanta, Georgia. And today we're going to talk about a topic that you hear about a lot, respiratory droplets and how they spread COVID-19. Okay, we know that we want to keep from getting infected with the virus SARS-CoV-2 so that we don't get sick with the disease COVID-19. But how does the virus get from one person to another? The answer is actually different for every virus, but for SARS-CoV-2, the main way that the virus seems to travel between people is through something called respiratory droplets. But what are those? In this case, droplet doesn't just mean a water that you can see, like big raindrops or splashes in the sink or a pool. These droplets we're talking about are actually really tiny, and where they come from might surprise you. You might think that when you breathe out, all that comes out is air, right? You don't see anything else. But in fact, our breath contains a lot of water. And usually you can't see that water. But think about it for just a moment. When you go outside in cold weather and you breathe out, you see your breath. Or if you breathe on a mirror, it fogs up. Or this one actually happens to me all the time. When I'm in the hospital, I put on my mask and my glasses start fogging up. What you're seeing in all these cases is not air. It's all the water in your breath. Those are your respiratory droplets. So every time that we let out air when we breathe, whether we're talking or singing or just sitting here breathing, we also let out those little tiny respiratory droplets. I'll pause here for a moment and say that although all of these droplets are small, they aren't all the same size of small. Some you can actually see, like when you sneeze. Most of them, though, are sizes that we can't see. And different size droplets can travel different distances in the air. Some will go farther than others. The distance they travel also depends on other things like the air currents in the room or how strongly they were pushed out, like when you cough. We'll talk about these ideas more in another episode later on because this difference in sizes is very important for certain things we do in infection control. For now, though, it's important to know that even though these droplets come in a lot of different sizes, they're all small enough and light enough that if another person is close by and we aren't wearing our masks, say we're eating at a table or we're with a patient who doesn't have a mask on either, then that person can breathe in the droplets that we've just breathed out. And when someone is infected with SARS-CoV-2, those tiny respiratory droplets have virus particles inside of them. If you breathe in respiratory droplets, they're carrying that virus that can then get onto your nose and into your throat and your lungs. It sounds really gross, I know, but that's what happens. And they can also land on your eyes. And when those droplets land in all of those places, the virus lands on cells. Some cells they can't get into. They just don't have the way in. But like many other respiratory viruses, SARS-CoV-2 is able to get into a lot of cells in our nose, our throat, our eyes, and our lungs. And when that happens, the virus can then hijack the cells. And that's how we get sick with COVID-19. We'll talk more about how exactly viruses hijack cells in another episode, so be sure to stay tuned for that. Now, if the goal of infection control is to keep people from getting sick, and we know that respiratory droplets are the main way SARS-CoV-2 moves between people, then we know that the actions that we take for infection control and that we need in healthcare settings are things to keep people, ourselves and our patients, from breathing in each other's respiratory droplets. I know there are a lot more questions about this topic. We've covered respiratory droplets very quickly today, and we'll talk more about them in future episodes because there's a lot to cover. For the meantime, thank you all for joining us. As always, be sure to follow up on Facebook or Twitter and check us out on our website at cdc.gov/Project Firstline. We'll see you back for the next episode.
Oh, wrong one. Sorry, guys. Yeah, this is the right one. Okay, so you should be seeing my slides again. So when we think about what Dr. Carlson had to say today, think about how respiratory droplets are part of your everyday life as well as your work life. You know, how many of you have seen an image like this one? When we look at a picture like this, it's easy to understand why these little droplets matter and why we care about preventing people from breathing in each other's respiratory droplets. You guys will never look at a sneeze the same way after you've seen a picture like this. Or if you happen to work in a office environment with cubicles, these droplets actually travel over the top of a cube. So any thoughts about how respiratory droplets are part of your everyday life or work life? Feel free to type in chat. I'm going to change the page because this kind of grosses me out. So what is your facility or your organization doing to keep people from breathing in each other's respiratory droplets? What are you guys doing? And please type this in chat. What strategies are in place for you all?
From the last slide, we did have a comment of a concern when our clients are sneezing and they refuse to wear a mask. That's a concern. And then we have a comment about how to approach that is encouraging social distancing and smaller groups, as well as wearing masks, continuing to stay 6 feet apart. We have another masking and social distancing, and another masking and social distancing.
And to address the question about, you have a client that refuses to wear a mask, if you're wearing your protection, you are stopping those droplets from entering you if you've got on a mask and some type of eye protection. And depending on what level of in your face those clients are, eye protection there's multiple levels of eye protection. Somebody doesn't have their phone on mute and we're hearing you, or your computer on mute. You can wear glasses. You can wear something like this. This is probably the least protective type of eye protection. These are basically glasses, but they do wrap around the side of my eyes. I don't wear these often because they fog horribly when I have a mask on, if I have a mask that doesn't seal well. With an N95, they don't fog as badly. You can wear goggles. which seal tightly against your face. Those offer an additional level of eye protection. And then the face shield is the most protective for you from spray hitting anywhere in your face. So the other thing to think about is if you have a client that refuses to wear a mask, see if they'll wear a face shield. With residents with dementia in long-term care, they, especially men, if they're used to wearing a hat, they don't argue with a face shield because the face shield goes around, especially the kind that wrap around. It feels like a headband on a hat, and that helps be a little more protective for them. Hope that answered your question that you were having or thoughts you had. Anything else that anybody wants to share about what you're doing in your organization to protect you from respiratory droplets? Are you all having any issues with getting supplies? How about if you have appointments? Are you scheduling the appointments with those clients so that they're not in the same space at the same time to protect people that way? The other thing that I know I've experienced this with the dentist, you have to call in before you get there so that they know that you're coming. They can give you the all clear to come in. Also limiting the number of people in a space helps with that respiratory protection.
We do have a comment about how this organization does one-on-one appointments and sit in the car until they call us in.
Mm-hmm.
So just a very structured approach.
That's good. That's good. So thinking about the things that you all are doing, is it easy or hard for your staff or your clients to do? And you can type your responses into chat, or you can put yourself off of mute and respond that way if you'd like. The person who responded that you have clients who refuse to wear masks, would you say that's a hard task to get them to wear some kind of respiratory protection?
We have answers yes, and it states yes, hard for some. Most comply, but we have issues with some.
Okay, so consistency is pretty good then. Would you say that?
Yes.
Okay. So as we talk about, do you have signage that helps promote? One of my speaker notes says something about teamwork. And I know I was in a dementia unit or a memory care unit, and there was one resident who her foot liked to wear her mask instead of her face. And so the team was really pretty good about going by and reminding the residents in that location that they needed to put their protection on and, kind of make it funny. It works better when it's on your face, Susie. It's not, something that you want to have on your foot. And you have to walk a fine line. I understand that sometimes with the developmentally challenged folks or folks with memory issues, because you don't want to agitate them. So if you can come up with that solution that works best and keep going that way. So can you think of reasons why things are hard to implement? What are some of the barriers that you're coming up against with implementing respiratory protection? Okay, so we're going to move on to another question, which might be more challenging. Oops. I think I got off here.
We do have a few comments that just came in. One states we have a very small few who don't believe the virus is real or that it's a big issue. We have a comment stating there's differing opinions and information. And another comment that states breathing under the mask is hard for some, which brings on additional anxiety.
Those are all very relevant things. With respect to the not believing, all we can do is continue to put facts in front of people. And somebody described it once as a truth sandwich. I heard somebody describing the conversation as a truth sandwich and stating a fact in the beginning, dispelling whatever the issue was, and then saying another fact on the end to keep it just clean and simple. And I think we're all at a point now where we know that there are people we just can't argue with. And so what we need to do is keep ourselves protected and try and just be as consistent as we can in what we do, and ask as much as we can without causing great agitation that requires us to call security. So when we think about today, we've covered a fair amount of ground, but I'd like to encourage you to reflect for a minute about your own job and how you can positively promote respiratory droplet protection. And I encourage you to type in some action steps that you can take, or write them down on a pad at your desk, or things that you've already taken and would like to affirm as a positive movement. So I'll give you a minute to do that. Okay. Did we get anything in the chat, Brenda? Okay.
No, not at this time.
As we move through these sessions, at the end of each session, we are going to take a minute to do that so that you can take some time to write down something that you want to pull out of each of the sessions that you listen to, that maybe you want to communicate with others in your organization or family, or, friends, people that you want to help along. And it's really important to continue thinking about how we can each feel empowered to act for our own health and the health of others. And at this point, that's really where we need to be with this. So key messages from today: our breath contains a lot of water that you usually can't see. When we breathe in cold air and see our glasses fog up when we're wearing a mask, that's the water that's in our breath. Those are our respiratory droplets. And the primary way that SARS-CoV-2 spreads and causes disease is through respiratory droplets, which is why, because they are breathing out droplets with virus particles in them, that's why it can breathe or end up in our eyes, our nose, our mouths, and we need to make sure that we're wearing masks and protection. And we can be infected, as we learned last week. We can be infected and be spreading it and not know it. And with the even vaccinated, the Delta variant is infecting a lot of people who are vaccinated. However, those who are vaccinated are not the ones that, as a rule, are ending up in the intensive care on ventilators. So we need to keep focused. Next time, we're going to talk about how viruses spread from surfaces to people. And so, like they said, like Dr. Carlson says, you can go out to the Project Firstline page on the cdc.gov website and further explore things on your own. There are things out there in social media as well, and you can sign up to get emails from Project Firstline if you want. So that concludes the formal presentation. As always, please let us know what you think. Tell us what you enjoy about the sessions, what you would like to see moving forward. And we thank you for joining us today. Like I tell everybody, stay safe and thank you for everything that you do. Hang in there. You are valuable assets and we need to keep you moving and going and happy and still here with us. Thanks all.
Thank you.
Chat saved, so I'm going to close us out. For those on still with us, have a great weekend.